Post-traumatic stress disorder, PTSD, is a condition that can follow experiencing or witnessing any disturbing event that makes you fear for your safety. While it's normal to feel frightened, sad, anxious, and disconnected after a traumatic experience, if the upset doesn't fade, you may be suffering from PTSD. Most people associate PTSD with rape or battle-scarred soldiers, and military combat is the most common cause in men. But any event or series of events that overwhelms you with feelings of hopelessness and helplessness and leaves you emotionally shattered can trigger PTSD, especially if the event feels unpredictable and uncontrollable. PTSD can affect people who personally experience the traumatic event, those who witness the event, or those who pick up the pieces afterwards, such as emergency workers and law enforcement officers. It can even occur in the friends or family members of those who went through the actual trauma. Whatever the cause for your PTSD, by seeking treatment, reaching out for support, and developing new coping skills, you can learn to manage your symptoms, reduce painful memories, and move on with your life. Traumatic events that can lead to PTSD include war, natural disasters, car or plane crashes, terrorist attacks, sudden death of a loved one, rape, kidnapping, assault, sexual or physical abuse, childhood neglect, or any shattering event that leaves you stuck and feeling helpless and hopeless. Causes of PTSD. When you experience a stressful event, your nervous system reacts with the fight or flight response. Your heart pounds faster, your blood pressure rises, and your muscles tighten, increasing your strength and reaction speed. Once the danger has passed, your nervous system calms your body, lowers your heart rate and blood pressure, and winds back down to its normal state. PTSD occurs when you experience too much stress in a situation. Even though the danger has passed, your nervous system is stuck, unable to return to its normal state of balance, and you're unable to move on from the event. Recovering from PTSD involves helping your nervous system become unstuck so you can heal and move on from the trauma. PTSD develops differently from person to person because everyone's nervous system and tolerance for stress is a little different. While you're most likely to develop symptoms of PTSD in the hours or days following a traumatic event, it can sometimes take weeks, months, or even years before they appear. Sometimes symptoms appear seemingly out of the blue. At other times, they are triggered by something that reminds you of the original traumatic event, such as a noise, an image, certain words, or a smell. The four main types of symptoms. 1. Re-experiencing the traumatic event, which can involve intrusive, upsetting memories of the event. Flashbacks, acting or feeling like the event is happening again. Nightmares, either of the event or other frightening things. 2. Avoidance and numbing, such as avoiding activities, places, thoughts, or feelings that remind you of the trauma. Inability to remember important aspects of the event. Loss of interest in activities and life in general. 3. Increased anxiety and emotional arousal, hyperarousal, symptoms which includes difficulty falling or staying asleep, irritability or outbursts of anger, difficulty concentrating, hypervigilance on constant red alert, feeling jumpy or easily startled, self-destructive or reckless behavior. 4. Negative thought and mood changes such as feeling alienated and alone, depression and hopelessness, feelings of mistrust and betrayal, guilt, shame, or self-blame, substance abuse, physical aches and pains, suicidal thoughts. Treatment for PTSD typically involves therapy, medication, or a combination of both. Therapy can help individuals process their traumatic experiences and develop coping strategies to manage their symptoms. Medications, such as antidepressants or anti-anxiety medications, can also be prescribed to help alleviate symptoms. It is important for individuals with PTSD to seek help from a mental health professional, as untreated PTSD can lead to long-term emotional and physical health problems. With the right treatment and support, individuals with PTSD can learn to manage their symptoms and improve their quality of life. Kindly follow our page, like and share our videos with family and friends.